everyone. So let me ask you a question. Has your little one ever had a bump or a fall that caused an injury to their mouth or their teeth? I think the answer is yes, because it's just one of those things that's part of childhood, right? So what I want to do today is to do a little educational video to talk about some of the do's and don'ts of how to handle toddler trauma. So what makes me qualified to talk about this? I am Dr. Bana Ball. I am a board-certified pediatric dentist. I am the founder of Shady Grove Pediatric Dentistry in Rockville. And I want to do a series of educational videos. And today's topic will be toddler trauma. I think it's super common. It's something I see all the time and very relevant and hopefully helpful to moms and dads out there, just to know kind of some first steps and some basic, first aid and what to do. And I do have a few notes that I'm going to look at just so I can stay on track. So, actually, before we get started, can you do me a favor and type in the comments where you're watching from, and just say hello, and let me know if you're watching live or if you're watching this later on the replay. I would love to know that. This will be really helpful to me for future videos too, and I'll remind you again at the end, but if you want to type in the comments too, like what topics would be interesting to you, what you would like to hear about, I'm all in. I love education, so just let me know and I'll be happy to tailor the topics to the needs of the community. So what we'll start with is we're going to start with the most extreme example actually of baby tooth trauma, and we're going to focus on baby teeth today. So this is basically, preschool age, they're the most trauma prone group, of course, in those wobbly early years as they're learning to walk and just don't really understand consequences as well, and things like that. So the most extreme example of something that can happen is if the entire baby tooth actually gets knocked out of the mouth, right? And that can be a super startling thing. Sometimes the force is very strong but very direct, and it may only do that and you may not see a whole lot else, but most likely there will be some other sort of co-injuries, and so you might have a whole bloody mess on your hands, especially if there's a little piece of tissue. It looks like a fleshy little curtain right up there. It's called the frenum. If that gets torn too, which is pretty common during trauma, just expect to see what will seem like lots and lots of bleeding. And of course, the way you handle the bleeding is apply firm pressure. The best thing to do is just grab a washcloth, preferably not white. That's a little pro tip. Get a dark washcloth so it's not as unsettling when you see the blood, which will seem like it's more than it really is. But apply pressure if there's bleeding. If you can get a dose of Motrin into your kid, that will be helpful both for pain control and to reduce the inflammation and therefore the swelling. But once you've kind of cleaned them up and gotten the bleeding under control, I do want you to try to look at that spot where the tooth used to be, and just verify, is it truly gone? Start looking around. Do you actually find the tooth? Or is it possible that it actually got pushed all the way up into the gums, which is not super common, but definitely possible. It can be a fully intruded tooth that's just got jammed up in there. And so ultimately an x-ray would show that. But if you can't find the tooth, there's a chance that happened. Now, if you do find the tooth, please, please, please do not put it back in. This is super important. For a permanent tooth, yes, you would want to. The sooner the better. But for a baby tooth, no. And this is crucial because you're actually going to be putting the developing permanent tooth at risk of significant damage if you try to re-implant the baby tooth into that socket. So leave it out, but still bring it with you to the pediatric dental visit, because it's still good to have it professionally inspected. Because what if the entire tooth didn't come out? What if it's just a part? So save it, don't put it back in, and don't ask the dentist to put it back in either. And if they're a pediatric dentist and they know how to handle pediatric trauma, they would never even agree to do it. But still try to find the tooth if you can. And then what else? So And by the way, one thing I should mention, so for a permanent tooth, which isn't the focus for today, but for a permanent tooth, time is of the essence. So every minute matters. That's why we say try to put it in yourself before you even bring your child to the office. With, the baby one, I mean, once it's been knocked out, it's out. No one's going to want to put it back in for you. So it's not as time sensitive for you to like rush into the office right away. Comfort your child, make sure you're both calm. If they're just a total mess, you can postpone that visit. I mean, I wouldn't go more than about 24 hours, but as long as they get evaluated within a reasonable amount of time, there's a good chance that an x-ray will be taken just to see if there are other injuries that are not as glaringly obvious as the missing tooth. But for the most part, I mean, mainly don't try not to panic, I should say. And then okay. Oh, why would you want to see a pediatric dentist, by the way? So a pediatric dentist does have an additional 2 to 3 years of specialized training in children's oral and dental health issues, including lots of trauma experience during residency. So it does matter for both treatment at the time of the injury as well as the follow-up care to have someone who is really knowledgeable and experienced in how to handle these. Okay, let's move on to a second type of trauma, which would be called a luxation. That's the sort of the official diagnosis. Essentially what that means is the tooth has been displaced in some direction where it doesn't belong. So either it got pushed out, it got pushed back, in, or it's off to one side or another. Those injuries, depending on the severity, sometimes repositioning is done professionally. Obviously, that's not a do-it-yourself project, but and then sometimes if it's more mild or it's not interfering with the bite and with chewing, then sometimes we just leave it be and monitor for a while. And every once in a while, you get a little bit of natural repositioning towards the original position, and sometimes you don't, but it's not necessarily a problem. But that is something where you would want to try to bring your child in ASAP, because once a blood clot forms, it's going to be harder to move the tooth around if we're trying to reposition it. So just give us a call right away, and we'll get you seen. And then the third type, which is the most common, will be the little chips, basically. And I say little because that's the most common. It could be a significant chip, of course, depending on what happened and what caused it. And if it's just a small chip, it probably happened. They can happen so easily. It could be something as simple as just biting down on a metal utensil or a hard plastic toy. So it doesn't take much. Baby teeth overall tend to be somewhat brittle. The enamel is thin and it chips pretty readily. And now if something more substantial happens and it's a big chip and a big portion is broken off, then the management kind of depends on, okay, a couple of things. One is there nerve exposure? Like, do we see an actual little bloody spot from within where the vital tissue inside the tooth is? Has that been exposed? If yes, of course, that's more problematic than if it hasn't. Another thing we would need to look at is, are the edges sharp or rough? Do we need to smooth something out? Do we need to add a little bit of additional material and bond that back on to kind of make the tooth whole again, more or less? And then the child's age and expected cooperation, of course, plays into this whole equation. So that's very case by case dependent, I should say. And I would say in any case of trauma, it's never wrong to give a little bit of anti-inflammatory medication. That certainly can always help. And try to reassure your child, let them know you're going to take them to someone who's going to be able to help them and take care of them. I wouldn't go into any details or speculate on what will or won't happen, because sometimes we just don't know until we really assess. And again, a lot of times an x-ray or two might be needed to really get the complete picture and know how to most appropriately manage. But a pediatric dental office is definitely where you'd want them to be. So if you already have a pediatric dental home for your kids, that's awesome. If you don't, let me tell you a little bit about us. So Shady Grove Pediatric Dentistry, we're very new. We just opened 2 months ago. And there are three things that we essentially strive to become known for in our community. One is an atmosphere of joy and laughter, which is possible in a dental office, and you will feel sort of that positive and that joyful energy that we have in our space. Number two is community impact. So we want to be sure that we are improving children's lives beyond just the walls of our office. The main way that we're doing that is through our partnership with the Hope for Henry Foundation, which is a local nonprofit that helps sick children in the hospital improve their experience and make them participants in their own care. It's a really wonderful organization. I encourage you to learn more about it at hopeforhenry.org. And number three is child-centered and individualized care. So we don't have a cookie-cutter approach. We really try to be very methodical in our ways of creating an appropriate plan for each child and each family, and really catering to their needs. So again, if you have any special requests for topics that you'd like me to talk about, I'm very nerdy and I love anything tooth talk related. We will call these Tooth Talk Thursdays, which I know is cheesy, but I think it's kind of catchy. So I will do another one of these next Thursday. I'd love to get some feedback in the meantime, and be well, everyone. Take care.